Hello, I'm Dr. Janet DeMille, Medical Officer of Health of the Thunder Bay District Health Unit. I want to provide you an update today on COVID-19 in the Thunder Bay District Health Unit area. Specifically, I'm going to talk about three things. I'm going to provide an update on our current situation and numbers. I'm going to provide some comments about the provincial update that was provided this past Monday. And I'm going to talk about two key areas of focus for public health in the coming days and weeks. 2 weeks ago, I did a video update in which I indicated that April would be an uncomfortable month. At that time, I said we would see an increase in the number of cases in our community, and I also indicated we would see increased evidence of community spread of the virus, something that we were just starting to see at that time. Well, both of these things have happened. This is also what I would continue to anticipate over the next coming weeks and months. Currently, there are 55 confirmed cases of COVID-19 that have been identified in the TBDHU catchment area. 37 are resolved, meaning that these individuals have cleared the infection. 6 people have required hospitalization, 4 of whom are currently in hospital. At this time, we have not had any deaths due to COVID-19. We had one outbreak on a mine site that is now under control. We have not had any outbreaks in long-term care facilities. Collectively, we have done a significant number of tests, over 1,700 throughout the communities in the TBDHU area. We have had the 55 positive results. There have also been over 1,400 negative results. And there's some other test results from tests that have been done in the last few days that are still pending. I will come back later to talk about testing. In the 55 cases that we have had, travel was the main risk factor in our early cases, with 8 directly associated with travel. In the last week to 10 days, the outbreak on the mine site has resulted in 9 cases directly associated with the mine. We have followed up on all individuals confirmed with COVID-19. Through that work, we identified 24 additional cases of COVID-19 who are closely linked to those initial cases. The 24 cases represent 40% of our total case number. These cases are not surprising. This is an infectious virus, and we often see spread in people who are close. For example, individuals in the same family or in the same household. There are 14 individuals where we have not determined where they got the virus from. These 14 cases are all in the Thunder Bay and surrounding areas. These are further indications that the virus is in this community and that there is spread of the virus here. This is not surprising, as I indicated before, as we saw early indications of this in early April. What we are not seeing in our numbers is a significant rise or surge in the number of community cases. A surge in community cases is what causes the significant issues we often hear about in the news, such as those that have happened in Italy or more recently in New York City. When there's a significant rise or surge in the number of cases, this can significantly impact our community and our healthcare system. Again, we are not seeing that here at this time. So I now want to provide you some information about the provincial update that was provided this past Monday. As you may recall, several weeks ago, Public Health Ontario, the University of Toronto, and the Ministry of Health did some modeling and provided projections on what could be expected in Ontario in the month of April and beyond as it related to COVID-19. Recently, the actual numbers were reviewed and analyzed. Some conclusions were presented on Monday. Overall, as a province, we are doing okay. The analysis has determined that provincially we have reached the peak, and that in terms of the projections done 2 weeks ago, we are tracking closer to the best case scenario and not closer to the worst case scenario. It could still take a while to get over the peak and start going on the downside of the curve. However, we should start to see things get better, at least from a community spread perspective and provincially, over the next few weeks and months. The public health measures that have been put in place to enforce strong physical distancing, such as the closures of schools and restaurants and non-essential businesses, as well as the measures we are all taking as individuals and families, are all contributing to this. Unfortunately, the analysis at the provincial level, while showing improvement on the community side, showed that there are vulnerable populations that are disproportionately impacted in very significant ways, and that this situation is getting worse. A big example of this is with long-term care homes. There have been significant outbreak situations in long-term care facilities and in retirement homes which have had significant consequences, including the loss of life. There are also outbreaks happening among individuals in other types of settings, such as homeless shelters. We need to be mindful of these things and be prepared for this. So now I want to talk to you about some of the areas that we are focusing on here in public health at this time. First of all is increased testing. Testing has been an issue here, with the limitations in testing supplies, and the capacity to analyze the test specimens, and challenges with the time it takes to get the results back, known as the turnaround time. These challenges have impacted us here. I would have liked to have seen more testing done in our populations earlier. However, work at the provincial, regional, and local levels have addressed a number of the challenges, and there is a push for increased testing currently, at least for now. This has benefited us in that capacity has improved here. We are able to increase testing opportunities here, both in Thunder Bay and broader catchment area of the health unit. As part of this, we are also able to test a broader range of people. This is a tricky virus. Some people have very mild symptoms, so the threshold for testing has been lowered, with people with only one symptom now being eligible for testing. Increased testing is important so we can identify people with COVID and work with them and the people they are close to reduce any ongoing spread of the virus. Testing is also important because it will give us a better understanding of what's happening in our communities. So working with partners such as the Thunder Bay Regional Health Sciences Centre and the COVID-19 Assessment Centre that they operate, and the Community Paramedicine Program, as well as the assessment centres and healthcare partners in the district, will help increase the testing that we're doing. Note that this weekend, the health unit will be hosting another drive-through testing event at the main office here at Balmoral. This is in conjunction with the Community Paramedicine Program. We also refer people to the assessment center at the hospital here in Thunder Bay, so please call us for an appointment for testing. Remember, you only need to have one symptom. We are also exploring further opportunities to promote testing in the district communities. Another key area of focus in the coming days and weeks is long-term care homes and retirement homes. The province has developed an action plan for long-term care and is in the process of implementing that plan. TBDHU has strong connections with the long-term care home sector in our area. So we have allocated additional resources to being able to implement the necessary measures to manage the risk in these areas. So in conclusion, I just want to say that I think we are doing well currently in the context of this global pandemic. However, that's not meaning to suggest that we are out of the woods. We are not out of the woods yet. We cannot let our guard down. We have collectively held off this pandemic for now, but we must continue doing all the things that we are doing as individuals, as families, and as communities to keep this virus at bay. As we see ongoing improvements in the numbers, we will be able to consider the relaxation of some of the measures that have been imposed to promote and enforce physical distancing. However, this must be done carefully and it must be done strategically. Relaxing these measures too much or too soon can quickly put us back on a track that can have significant consequences, negative consequences for us, our communities, and our healthcare system. These are challenging times. These are uncertain times. Stay safe. Take care of yourselves, including your mental health. Remember that we are all in this together. We have done well up till now, and we can continue to do well. So thank you very much for all that you are doing.